especially now as we get into our next discussion this morning, which is about cervical cancer. Of course, cancer in general has been a huge topic in this country for the last several months, years, and cervical cancer in particular is one that is ravaging the lives of a lot of women in this country, and that's what we want to talk about. And to tackle it, I have a very able guest who has actually watched me grow up since I was a child. We would go to the same church, when I was growing up, and her name is Dr. Jane Wakahe. Karibu sana to the show. It was a great surprise to see you here this morning. And she's a gynecologist, and so fully able to help us unpack this subject. Now, Dr. Wakahe, explain to us, what is cervical cancer?
Cervix is the mouth of the uterus of the womb. And cervical cancer is a cancer that attacks only that mouth. The mouth of the womb is that which opens when a baby needs to come out. So it's the lower segment, the lower area of the uterus. So cervix can be attacked by something called human papillomavirus. And if it persists, it can cause it to get into cancer.
Right. Yes. So it can be caused by this human HPV virus.
Actually, it is caused by 99.7% of all cervical cancers
is HPV
are associated with HPV virus.
Okay. Yeah. So talk to us then about this HPV. Is it something that everybody has a measure of, or are some people more predisposed to it? Is there a way to know if one is going to possibly experience cervical cancer later on in their lifetime?
HPV is called human papillomavirus. It's the commonest sexually transmitted disease globally. If a woman is sexually active, they stand a chance of, by the time they are 50 years, they have an 80% chance that they'll have gotten human papillomavirus.
So it is the males also transferring it?
It is both males and females.
So even men have this HPV?
Even men have HPV. HPV is found in the anogenital region, around the anus, around the genitalia, in the skin. When somebody gets infected with it, in 80% of the time they fight it off completely. So it's not everybody who is carrying it around, even if they get infected. Their immunity fights it off. But there's a 20% that is not able to fight it off. Those are people whose immunity may not be up to par, or whose immunity may be down because of things like HIV. So 20% will persist with the HPV. And if it persists and keeps subaceating to each other, then in a small proportion of that 20%, in about 5% of that, they will start to develop cervical cancer.
Okay.
Yes.
Okay, so it is passed around, both men and women have it, but it is passed around, it's the most commonly transmitted sexually transmitted disease, you said.
Yes, and I dare say it's not just transmitted by sexual intercourse. It is, but it's transmitted by contact from genitalia to genitalia. So even women who sleep with women can pass HPV to each other.
Wow.
Yes.
Okay, okay. What do the symptoms of this look like then?
Unfortunately, there are no symptoms. That's the problem.
Yeah.
Until human papillomavirus is just a virus that now invades and stays in the skin. In some people, it will cause genital warts. There are about 100, more than 100, about 170 types of human papillomavirus.
Yeah.
And most of them will cause genital warts, warts around the genitalia.
Yeah.
There are about 16 of them which are known to be high risk in causing cancer. Cancer of the cervix, cancer of the penis, cancer, oral cancer, vulval cancer, all kinds of cancer. But so of those 16 types, then if they persist in the body, then one needs to be checking that they are not getting that cancer.
That's very scary though, that there are no symptoms, because one could very easily continue their lifestyle, whatever it is, not understanding that in many ways that could be contributing to them suffering from cervical cancer.
Yes, yes. It's hard to tell that one has human papillomavirus. In the last few years, it's possible for a girl to harvest some material from their vagina and take it to the lab in special containers given in the lab. and they are told whether they are carrying this high risk type or not.
Right.
The only other way is to do pap smears or to do other screenings and check whether it is there. But
Okay.
it's before cancer strikes, it's impossible to know unless one screens.
Sure. Does that then mean if one is not doing these pap smears and these lab tests, do you then find that a lot of the cases where you discover cervical cancer are actually found in that very advanced stage because there's no symptoms, someone feels like they're normal, they just think it's a regular thrush or something? Does it then mean that a lot of people are actually discovering this when it's far too late?
That's the problem. By the time like cervical cancer shows signs and symptoms, it's already cancer. And yet a woman has about 10 to 15 to 20 years as the cervix changes from normal through some abnormalities that are not yet cancer until it actually becomes cancer. Now, when it becomes cancer, early cancer will show us a funny discharge. It will show us bleeding after sexual intercourse. It will show us a bit of bleeding when you physically exert oneself. So little symptoms here, discharge, things that happen to women. So it's not very clear that it's cancer.
Right.
But if any of those funny symptoms happen, kindly go and get yourself checked.
Right, right. Now, Dr. Wakahe, the truth is, because of what this disease is and the way that it is transmitted, a lot of people then assume that the people who contract it are sexually liberal, if I could say. And a lot of people would even go as far to say, the people, if you have that, it means you've been really promiscuous in your life or something like that. But then hearing you also say that it is very possible for a wife to be very faithful to her husband, but if he's moving around, because if even the men can carry it, he could actually infect his wife who's been sitting at home, faithfully for their 20-year marriage.
By the way, he doesn't even have to be moving around. He may be very faithful. They may have met and they became quite faithful to each other. But a few years before they met, he had sex with somebody who
even
had
just
had
one
HIV.
fling, and so the virus has just been sitting there.
Yes, and he wasn't able to fight it off. So yes, a girl can get married as a virgin, true virgin, and get 10 years later cervical cancer.
Wow.
Because the man didn't know that they had contracted HPV.
Where?
So it is possible. It's not a question of promiscuity. That's why people should screen. It's not that we are saying you're promiscuous or we are giving vaccine because you're promiscuous. It's that it just has no signs.
Right.
And unfortunately in our country here, the prevalence is very, very high. It's a bit high. It's about 38% will be carrying HPV, which is
that
very
like
high.
a genetic thing, or why is it so high? Does it affect, say, one race more than another, for example?
No.
Okay.
It affects everybody equally, but our behavior is such that maybe we transmit to each other a bit more.
Absolutely. Now, as we look at then the risk factors, so men can carry it, but they will not be affected, right?
So they get penile cancer.
They can get penile cancer.
Yes.
Sounds horrible.
More rare, much more rare than the cervical, but yes, it happens.
Okay.
HPV gives all kinds of cancers. It gives oral cancer.
Wow.
It gives anal cancer.
Yeah.
It gives penile cancer. Gives vulval cancer, gives vaginal cancer. It
So
gives
it's
many
quite
cancers.
aggressive then.
Yes, it's
It's
a
an
very
aggressive cancer.
Fortunately, all the others are not as common as the cervical cancer. Yes.
Okay, so men could be affected by this penile cancer, although it's quite rare, as you're saying.
Yes.
But a lot of women then may end up suffering cervical cancer if that virus is not fought off by their bodies.
Yes.
So in terms of looking at the risk factors then, because you said the cervix is that opening to the womb.
Yes.
What does that then do to a woman? What is the damage that we're talking about?
If cancer happens on the cervix and it grows and it's not treated in time to remove, if we catch cancer early, we are able to surgically remove it completely.
Okay.
And it's any kind of cancer, not just cervical.
Yeah.
The idea is to catch it early. But if perchance a woman is not doesn't represent herself in time, then the cancer, because of where it is a very interesting cancer. Because where the uterus is, in front of it is the urinary bladder. And behind it is the rectum with full of poo. So if the cancer was to be allowed to grow, and sometimes it does, and grows around the cervix so much, it happens to grow towards the bladder and will make a perforation into the bladder.
Okay.
And urine will start leaking through the vagina.
Wow.
It also can happen to grow backwards and make a perforation into the rectum, and stool can start flowing through the vagina. So we're talking, the cancer itself is like rotten meat. It's a growth. It looks like a cauliflower, only it's meat on the cervix that is growing, overgrowing.
Right.
So we're talking rotten meat with stool with urine. It's really a very, very terrible thing.
Yeah.
And the pain.
Yeah.
The pain.
Yeah. And the shame too. Just, I mean, walking around,
The
not knowing if you're able to
indignity.
control your
Yes,
bladder, and the
yes,
dignity. Absolutely.
yes,
We're going to take a short break now, Dr. But when we come back, I really want to find out, you know, if we're blocking the opening to the womb and whatnot, what does that mean then for fertility? And do a lot of people who are struggling, you know, what's the effect then on fertility or trying to have a child with this? And of course, I'll be taking your questions. Should you have any questions for Dr. here, you can send them in to 22111. 999 rather, 22999 is the SMS sign, and you can also comment on our Facebook page. We're also going to be looking at the treatment options if one does discover this early. So much more for you to stay tuned for. This is Full Circle with Joyce. I'll be back shortly.